I'm Clare Davies, and we're here for Mental Health Chats. And today I'm really pleased to be able to introduce to you Warren Davies, who is known as the Unbreakable Farmer. Hi Warren, how are you going?
G'day Claire, how are you?
I'm very well, thank you. And I'm really excited because, as you all know, I grew up in Australia, and Warren is from a country town in Northern Victoria called 𝗂𝗵𝗆𝗀𝗀. And Warren is going to be talking to us about coping in isolation. So coping in isolation is very, very, very interesting because we always think about people in the country areas, farmers who are isolated. However, what we need to understand is that isolation can occur for anyone, even if we're living in cities. And this series is on men and mental health. But all of the tips and advice that Warren is going to give us, and all of our speakers, Rob and Jason as well, apply to everyone. So it's going to be really advisable for anyone who finds they don't cope in isolation to listen. So Warren, the Unbreakable Farmer, tell us about that.
Well, Claire, I was a farmer for most of my life, or all my working life, really, from when I left school. I was actually born and bred in Melbourne, and our family moved to the country when I was about 15, and then I left school early at about 16 and become a farmer, and it was quite a journey. I dealt a fair few challenges along the way, which also impacted on my mental health along that journey as well. And got to a stage where I was searching for my identity, I suppose, and did a speaker course. And part of that speaker course was standing up in front of the group and sharing our story unrehearsed, and the facilitator didn't even give us any warning, so it was fairly, straight off the cuff kind of stuff. And as we were going to the coffee break, one of the guys come up to me and he said, "Oh, you're the Unbreakable Farmer." And I thought, well, that's a very interesting name. So I went straight to my computer and registered the domain name, and rest is history. But probably my story was more around probably being more broken than unbreakable. But I think it's a good, it's a catchy name. So I stuck with it, and it served me well.
I absolutely love that story. That's brilliant. And, that guy, wow, well done for getting such a great name as well. And, it's so fantastic. I know a lot of people from the farming community in Australia and over here in the UK, and it's so good to be able to support people and let people know they can talk about mental health and talk about not coping. So, Warren, our topic today is on coping in isolation. What words of advice would you give people in country towns, but also in the bigger cities? I know people in London, cities like London and Sydney, who feel isolated. So what words of advice would you give people when they're feeling isolated?
I think, Claire, I've got three lessons that I suppose they're lessons that I learn along my journey. And like my journey saw me spiral out of control, and I learnt these lessons the hard way, and they were probably things that I did wrong, or didn't do. And I think, as you said, anyone can be isolated. You can be surrounded by people and still be isolated. You can be standing in a room full of people and still feel isolated, and it's your mindset and how you're feeling at the time. And if you're struggling, you become isolated. And I think so. The three lessons that I share with any of the audiences that come and listen to me speak is, my number one lesson is that communication is key. We need to communicate with everyone, with the people around us, communicate our emotions, communicate how we're feeling, and what challenges we're facing. And particularly us blokes, and particularly in the rural setting where I focus a lot of my work on in rural and regional Australia, is that, it's not something that we talk about easily, our emotions, and we're very guarded about that. We need to express that more and talk about that. So that's why communication is my number one lesson. My second
question on that,
yep.
Warren.
Yep.
Sorry to interrupt you, but if we're feeling isolated, we don't really feel like communicating and talking to people. So what would be your advice for somebody who, communication's great, and that's why we're doing mental health chats, to open up those conversations. But if we're feeling really isolated, and loneliness is known to have more detriment to your health than smoking 15 cigarettes a day. So if we're feeling isolated, what can we do?
It's a really tough one. With, when you get to that stage, when you're isolated, when you feel like you're isolated and you can't reach out. But the thing I always talk about in that communication piece is understanding who your support network is. Knowing who your 5 people are in your life that you love and you trust and you can communicate. And I think part of my mission is around awareness, but also about education. And, for someone who's really stuck in that isolated, feeling so isolated, it's, I hopefully they take these lessons before they get to that stage and set up like this plan of knowing who those 5 people are. But understanding if you are isolated, it's okay not to be okay. And it's okay to reach out, whether that is to your support network or to professional people. You need to talk. And that's the first thing that will get things moving again moving forward for you, is by actually talking about it and reaching out and however you want to do that. And obviously there's some good initiatives with in Australia particularly that I know of, like with Lifeline and a lot of virtual psychology kind of organisations where you don't have to talk, you can actually text. If you just don't feel like talking about it, which is a really, that is a tough one. When you get to that lowest of lows, it's hard to actually reach out and talk about it. But I can tell you from my experience, that conversation is like lifting bricks off your shoulder. Yeah. And it's an important step in your recovery, or at least getting on that pathway to be able to get the help that you need.
Yeah, thank you for that. And it's something that Benny and I have discussed a lot, the early intervention before it gets out of control. So what's your second lesson from this?
My second lesson, and it kind of goes hand in hand with the first lesson, and it's about staying connected to your community. And whatever your community means to you, whether it's your family, your close friends, your sporting groups, your work colleagues, whoever your community is, or you're, living in a rural town, whether it's your whole community, staying connected and not isolating yourself. And as I said, at the outset, these are my lessons. They're the things that I did wrong. So when I did spiral out of control, I never stand up in front of audiences and say I've got all the answers, because they're the things that I did wrong, or I didn't do well, and I isolated myself from my community. I stopped doing all the things that I loved doing. I stopped playing footy. I stopped being involved with the school, and isolated myself on my farm, and it was detrimental to my mental health, because basically it was me and my thoughts, and at that time they weren't the best. That wasn't the best conversations to be having. So, and staying connected to that community is important, and connected to that support network that you're acknowledged and identified. And I think out of anything that I do and say whenever I'm speaking, what's one of the biggest lessons I hope people take away is, sitting down after someone's either heard this or heard one of my talks, and sitting down and saying, well, who are my 5 people? Who are those 5 people that I, if the proverbial hit the fan, who can I turn to and have these tough conversations? That's
so important. And so often when we're feeling isolated, we feel like that we don't want to get involved in a community because we can feel so negative. So I love that advice. Thank you for that. And the third lesson that you learned?
My third lesson was about seeking help and getting on that pathway to help. But not only that, but treating it seriously, because when you're struggling with your mental health, You know, a lot of the times it can be physical. It can develop into, you know, a physical ailment. But because, you know, especially in my line of work, being a farmer, not having a broken arm or a broken leg meant I could still work. And if you push yourself, you can keep going. But that's also can be detrimental. I talk about resilience a lot too, and you can sometimes have too much resilience. You know, you can keep pushing yourself past breaking point. And a lady that I spoke to not so long ago, her take on resilience was, you know, resilience is really the lack of any other options. So you've got to bounce back and you've got to keep going. But sometimes when you're really struggling with your mental health, that can be an adverse thing to be doing, because you need to stop and you need to reach out and seek help. And seeking help is my third lesson, and taking that seriously. Just because it's your mental health doesn't mean it's any less important than your physical health. You need to be making sure you're looking after yourself.
I love your advice. Thank you so much for this, Warren. It's very, very important for people to take this on board, because we don't want our mental health to spiral down, because that's when it can affect our physical health and it can affect us long term. So Warren, you mentioned that you give a lot of talks. You're the Unbreakable Farmer. You've obviously got a website, because I've looked at it. So I'll put the website up there. So are you happy for people to contact you if you'd like anyone to reach out to you to give some talks?
Yeah, I'd love that if people would reach out. Like I get, just in the last few days, I've had a number of messages come through. Like, people are, you know, here in Victoria where I am, we're in, well, Melbourne's in stage 4 lockdown, and we're in stage 3 here with COVID and that. And people are really struggling at the moment with that isolation. And, you know, and when I talk about communication, I actually also mean having conversations with yourself to make sure that you're checking in with yourself and that you're doing okay. You know, have those internal conversations, even though sometimes people look at me a bit strangely thinking, well, isn't that, you know, madness, talking to yourself? But it's not. Having internal conversations and understanding your emotions and where you're at. And, you know, and if you do feel that you're struggling or you're facing challenges, that's the time to reach out. And I'm happy for anyone to reach out to me if that's what they feel like they need to do. And I can always point them in the right direction for, you know, some professional help or some resources that might help them on their journey.
Thank you. Thank you very much for that, Warren. That's fantastic to know that you're there and you're happy for people to contact you. So we're continuing the series of men and mental health. And as I've already mentioned in the past talk on men and mental health, this applies to everyone. We've all got men in our lives, and the way that we all feel about ourselves with our emotional fitness is so important. So next time we've got 𝗖𝗵𝗆𝗀𝗆𝗀𝗀, and he's going to be looking at changing the identity of masculinity so that men can cope in difficult situations. So thank you very much for joining us, Warren, and best wishes.
No worries, Claire. Thank you.
And take care.
Thank you very much. Thanks for having me.
Bye-bye.
Bye. Cheers.